So this bone is the humerus. This is the upper arm bone. This one you can consider the brachial bone because it's part of the upper arm. Now the humerus has many features that are important muscle attachment sites or where joints form between different bones. So we're going to go through this one kind of slowly. So we're going to start on the proximal end up here. So this is the one that's going to articulate with the glenoid cavity. And then we'll do the distal end. This is what articulates with the radius and ulna. All right, so I'm going to switch this bone's view to here. And we're going to look closer in at the proximal end. So I'm going to zoom in here with my camera a little bit. Zooming in. So here we are on the anterior side of the proximal end of the humerus. So the main thing you can see is the humeral head. It's a rounded, smooth condyle, and again, this articulates in the glenoid cavity of the scapula. You have two important muscle attachment sites here on the proximal end. You have the lesser and greater tubercles. Again, these are just rough projections where muscles attach. So greater and lesser tubercles. And you have a little divot in between the two called the intertubercular sulcus. Sulcus means groove. So greater tubercle, lesser tubercle, intertubercular sulcus. So between the tubercles and the humeral head, you also see this little line. This delineates the anatomical neck, where the metaphysis would be anatomically in this bone. The surgical neck is where you would literally cut off if you were doing surgery. So surgical neck, anatomical neck, here in this little groove. And from the posterior view, really all you can see is portions of the greater tubercle and the humeral head on the posterior side. So we'll flip back to anterior and we'll move to the distal end. So as we move down, we see the diaphysis or shaft of the humerus. There is a little elongated bump here where our deltoid inserts. This is called the deltoid tuberosity. The more muscular you are, the bigger this would be. And the same is true for most muscle attachment sites. So now we're here on the anterior view of the distal end of the humerus. So this is where the ulna and radius articulate or form the elbow joint. And again, this is the anterior view. So these smooth surfaces are condyles, but we give them specific names here. Where the radius articulates, this rounded surface, is called the capitulum. This more hourglass-looking condyle is referred to as the trochlea. So the radius articulates with the capitulum, the ulna articulates with the trochlea. Now, as we bend our elbow in this hinge-type joint, so we're going to flex and extend that joint, parts of the ulna are going to squeeze into the humerus. So this is going to be known as the coronoid fossa, and we'll see why in just a minute. And this is known as the radial fossa. So as we bend, we have a little depression where each of those bones can go into. So radial fossa here, coronoid fossa here. Now most long bones have these condyles that are smooth, and on top of them you'll have a rougher surface where muscles can attach. So epi is a prefix that means on top. So this would be the medial epicondyle of the humerus and the lateral epicondyle of the humerus. So epi is on top of the condyle, and again, it's a rough surface of muscle attachment. Now, if we flip the humerus over and look at the posterior side, the capitulum goes away, but we can still see part of the trochlea here. And this big triangular depression is known as the olecranon fossa, and we'll see why in just a minute again. From the posterior view, you can still see your medial epicondyle and your lateral epicondyle sticking out. So that's the humerus.